Let's try that again. So in today's session, we're going to talk about the dynamics of addiction and criminal behavior. Over the next hour, we're going to examine the parallels between addiction and criminal behavior, discuss the benefits of both, identify the drawbacks to both, and describe what an effective, comprehensive reintegration model would look like. Before I left the agency that I worked for in Florida, we had gotten a SAMHSA grant, and we called it the No Wrong Door Initiative. But basically, people were released from jail or prison 30 to 90 days prior to their actual ending date. They came into treatment with us, and they were with us for 3 months to 6 months, during which time we helped address any underlying mental health issues, addiction issues, life skills issues. We helped them work with job coaches. They had to get a job in order to successfully complete the program. So there were a lot of things that helped them reintegrate into society in an attempt to try to reduce recidivism. And we're going to talk about one theory, not necessarily all comprehensive, but one theory about why recidivism is so high. Before we do, I do want to point out that 16.6 million adults, about 1 in every 12, suffer from alcohol abuse and dependence, and 6.9 million are addicted to drugs. So that's roughly 23 million people. Of that 23 million each year, right around 1.6 million are arrested for drug law violations. Okay, so that's a big disparity there. Even if you think, okay, my math isn't all that wonderful, so let's say 1 out of every 5 people committing a crime actually gets caught. So 1.5 times 5 is nowhere near 23 million. So we know that not all people who use drugs or use alcohol are committing other crimes. Now, obviously, if you're using an illegal drug, technically it's a crime. So the number may be a little bit higher, but I really want to focus on those people who are doing more than personal use, and they're experiencing multiple negative effects from it, and why the recidivism level is so high. Before we go into this too much, I want to define a couple of terms. Drug-defined offenses are those offenses that people go to jail for directly relating to a substance: possession of cocaine, possession of marijuana, manufacture of methamphetamine, something like that. That's the crime itself has to do with the illicit drug. Drug-related offenses are offenses which the drugs were involved somehow. Either the person was under the influence when they committed the drug, under the influence when they committed the offense, or they were trying to get the drug and something happened. They got beat up. Can't possibly hypothesize all the things. Or they were distributing or buying drugs and they got involved in violence, or something like that happened. So there